COVID cases and hospitalizations may be rising this week, but deaths remain low, about 1 in 1,000 cases. And that suggests that the vaccine has helped to break the link between infections and deaths. So can life return to normal? Let's take flu. How many of us actually know how many deaths are caused each year by flu? And I've got the answer here. In a bad flu year, 2017, 2018, 22,000 people died in England and Wales from flu. The average is about 17,000 a year. So if we had about 7,000 deaths a year from COVID, let's say, would that be a fair price to pay for lifting lockdown, Nina?
This is such a dreadful balance to be making between, how many deaths are we prepared to cope with? There should be a way of eliminating it to the nth degree that we can. We can't just give up and say, oh, we've got to live with it. It's always going to happen. Let's open everything up. Let's let everybody hug each other, kiss each other, sit next to each other at a football match. Just go on as normal and see what happens. You can't just do that and accept. And you're saying...
Well, so you can't accept 10,000 or 20, let's say 20,000.
Well, it's such an inhumane thing to do. Do you accept this amount of deaths? We should aim for 0 deaths in any situation.
That's right, Bev, do you think?
That's what we'd aim for.
To 0?
First of all, I would take issue with the figures that we've heard so far, because doctors do not routinely test for flu. So on some days at the moment, we're having over 1 million tests a day looking specifically for COVID, using a PCR test up to 40 revolutions, which is going to find fragments of genetic coronavirus. So if you ask any doctor, if we tested for flu as much as we've tested for COVID, we would find so many more cases of flu every year. So the figures are a sort of a strange kind of starting point in a way. But I understand why we have to do that, because we have to work out some sort of way out. And as Nina said, we've got to work out how to do this whilst protecting the vulnerable and whilst allowing those who are not at risk of death from living a full, rewarding life which is beneficial for them financially, emotionally, all of the things that we've neglected to put attention to in the last year. So I think moving forward, as you say, the vaccinations has been a success for those who needed it, a huge success, even though we are still seeing cases. But as I say, that could be to do with the fact that we're testing so many. We aren't seeing an increase in significant numbers of deaths.
No.
People do understand a little bit more now about the risk of how they go about their daily life. The only thing I would say, there's one thing that nobody really is talking about, which is there are some doctors, Dr. Renee Houdekamp is one of them. She's leading a group of doctors who are arguing that actually there will always be between 10 to 20% of people who've had the vaccine who will not get any cover from it, because they have underlying health conditions, they have autoimmune conditions. Her argument would be, those people need antibody tests. They need antibody tests. They need to know in this next stage coming forward, it is a bit controversial, but we could argue we should all be having antibody tests to know where we stand.
That's a bit of a blind alley. We're talking about whether we can accept, let's say, 20,000 deaths a year.
But we don't have to accept 20,000 deaths
a
year. Not if people know exactly what their immune status is.
We've pushed it back so far now, and we pushed it back to the point where if we stay at this level, we'll have 7,000 deaths a year. You think we should push it further?
The thing is, you are judging this on what's happening now. This virus moves so quickly and mutates so easily that we are talking about what we know now. A month from now, there could be another variant coming in from somewhere else.
The vaccines worked on all the variants so far.
So they seem to be. In South Africa, the Oxford AstraZeneca does not work well against the South African, I forget it was beta, it's not delta, but it's a gamma or whatever. And they're not working so well. So it's a very fluent and fast-moving situation.
Do you agree with Nina we could push it back to 0? Do you?
I don't think we need to push any risk of anything that's going to kill us back to 0. That would be like saying you should never get on your bicycle. I should never get in a car. But we should aim
for as low as possible. We should aim for as low as possible. Granted that we're supposed to be...
But it depends on the cost of that, Nina. I would say it depends what the cost of that is in all other areas. I mean, there are... How many people die from obesity in the world every year? It kills 2.8 million people globally. Just the fact that we eat too much and don't move enough. And we're not aiming for that number to be 0.
Yes, but
why?
With respect, Beverley, you can't catch obesity. You can't catch it. So if you're obese and you die from it, say, that is what you have done to yourself. It's not what somebody has stood next to you and given you. So that's
But that's why you've had your vaccine, because it will help you to not succumb to the virus.
First of all, the percentage of people who have had 2 jabs, the vaccine rollout has been brilliant, is not at capacity yet. Secondly, how long do they last? We don't know that yet. I'm taking part in Public Health England research on how many antibodies I've got. So I give a blood sample every 3 weeks, and it's going to be every 6 weeks. So when I was given my first jab in January, the doctor said to me, this will last 5 months. Now, that's just one doctor. Now, that takes me to now.
Might last the rest of your life.
Or it might not.
It really might.
We don't know that.
Okay, hang on. Let's go to calls. Storm.
We're going to go and speak to Lewis now from Merseyside, who says we can't let a virus rule our lives.
Ballpark figure, 10,000 deaths a year from COVID. That's part of life, Lewis, you think?
Yes, absolutely. Absolutely. Good morning. Good morning, panel. I love your show. It's great. But I think that we've had 150,000 deaths through this. It's been tragic. It's been tragic. But how many people die of heart attacks, strokes, cancer per year? It won't be far off that. It won't be far off that. Sure. And I just think that this has ruled our lives for long enough now. Yeah. It's about time that we packed it away. Previously, it was flu. That used to kill 30,000, 40,000 people a year. And I just think that we've got to live with it. We've got to live with it. It's not going to go away. And I just think that we should, just carry on as normal. Okay,
Lewis,
normal.
Thank you. Storm.
We're going to speak to Jackie now from Essex, who thinks we need to open up the economy before we run out of money.
Well, yeah, I dread to think what the economy is doing at this point, Jackie, but yeah, we haven't got much money left.
Good morning. I think it's a case of, if you want to have a full life, go out and enjoy yourself. If you're frightened, stay home. Because where's this money all going to come to? And one thing I would question, how many people out of those 120-odd thousand actually died of COVID? Because they're putting on the death certificate anybody who's died within 28 days of a positive test. I know 2 people that didn't die of COVID, but it's gone on their death certificate. We've got to get out there. We've got to start living.
We had excess deaths about 70,000, which is another guide to it. But you agree with that, Beverley? You think that we're putting COVID on death certificates when people haven't?
Believe that.
You don't agree?
I don't think. And the thing is,
no, I mean it is true. I mean even the NHS have rounded them down by about 25%. I mean
the public health, the national statistic the national statistic. Can't say it. ONS have said that the number of people with COVID on the death certificate is 150,000.
So, in other words, more than the number we've got?
Yes, absolutely.
Right. Okay.
Absolutely.
You don't agree with that?
In the fullness of time, we will understand these figures much better. There is a death audit being conducted at the moment by Dr. Claire Craig is one of them, and she is looking at every single case, and we will know.
This is one woman.
We
have got acres of scientists and
95%,
medical health
and you are only one woman too, Nina. But 95% of people who died with COVID had at least one other pre-existing medical condition.
All right,
often 3.
Let's pause. We'll go to the break, and then we'll take more calls and discuss this more. Could you live with, let's say, 10,000 COVID deaths a year, which is about the same number as flu that we have every year, if it meant that we were back to normal? 0207 862 2222. We'll see you in just a minute or two.
Which of these devices was invented by a dentist? Was it A, a tea bag, B, an electric chair, or C, a stapler? Find out which after this short break.
On My 5, embrace the great outdoors with the Owen family on our Yorkshire farm. Escape the daily grind with Ben Fogle and those who've chosen new lives in the wild, or experience the drama of an NHS night shift in A&E After Dark. Extraordinary Lives, all streaming now on My5.
Before the break, we asked which of these devices was invented by a dentist. And the answer is A, the electric chair.
Welcome back. Thanks for being with us this morning. Journalists Beverley Turner and Nina Myskow are with us. Let's remind you what's still coming. Right now, we're taking your calls on whether we should drop restrictions and accept maybe 10,000 COVID deaths a year will be part of our lives for decades. 0207 862 2222. And then, is 36 too old to have your first baby? After that, our stories of the day, including the Queen's plans for her 70th anniversary jubilee and how Wimbledon has taken a swipe at sexism.
Indeed. So if you want to get involved in any of our debates this morning, give us a call. The number is 0207 862 2222. That's 0207 862 2222. Calls from landlines may cost up to 16 pence per minute, plus any call set-up fees, and calls from mobiles may cost considerably more. To send us a message, head to Facebook or Twitter and search for Jeremy Vine on 5.
So more calls now on Boris Johnson's suggestion we learn to live with COVID, lifting restrictions, accepting that infections and deaths will become a normal part of life. The rate we've got at the moment, and bear in mind we're in lockdown, so it might be suppressed, we reckon 7,000 deaths a year would be the result. If we stayed at about this level, I guess more people will be vaccinated, so that'll push it down further. What have you got?
We're going to speak to Anne now from Essex, who says we should just avoid people who are not jabbed.
Right. What do you mean avoid them, Anne?
Well, I think that, we will get back to normal, but I think that in general people will try. If you know someone's not got jabbed, for instance, in your studio, there are not a cat in hell's chance, and I don't want to be rude, but I've listened to Beverley on previous your programmes. I would not sit 2 metres away for somebody who I knew had not been vaccinated in a room for 2 hours, possibly 3 hours. She may have come in early. You may have come in early. My daughter was in her 30s, was double jabbed, was working from home. One time she went out, she got in her car. She even had a filter between the 2 masks she had on her face, walked through an empty building with a contractor who had passed the virus onto her. She was shockingly ill. She wasn't hospitalised. She was shockingly ill. Then there was all the interruptions with all the...
Began by making a point about Beverley. We've never quite cleared up whether Beverley's had the vaccine, and I guess not. But you can respond, Bev.
So your daughter had the vaccines and then got very ill?
Yes, but she would have been much worse ill. She would have been hospitalised if she hadn't.
Possibly. Possibly.
But Anne, how would
Anne? You don't know.
How would we know? You're guessing about Bev, and I. How would we know who's not been vaccinated unless they have to wear special badges or something?
Of course, we don't know, but I'm saying in the cases when we do know, and often when you're in places of work, it's going to be more noticeable, and workplaces are going to have to sort of establish something, because people might say, I'm not coming in, I know she's not had the jab, or I think some of these things will happen. I think I'm one of many thousands who feel like this.
Okay, go on.
And it's just so sad, the misunderstanding about what these vaccines do. You take them to protect yourself. As you said, your daughter might have been more ill, might have been hospitalised, and might have died. It would very much depend on her age, on her weight, on her pre-existing conditions, as to whether she would have been more poorly with COVID. But the vaccines do not stop you passing it on. If you've had them, they do not stop you catching it from other people. They will reduce it. They will reduce it. They can reduce it. They reduce it because they ameliorate your symptoms. And if you aren't coughing and spluttering over somebody, you are much less likely to pass it on. But if you are talking about ameliorating symptoms, what we're discussing is asymptomatic transmission.
Okay.
Can I ask you, Beverley, have you had the Pfizer or the Oxford AstraZeneca?
Are we honestly...
I'm sitting here within feet of you. I have a right to know.
You have no right to know.
I have a right to know.
We do not. We have something in this country called medical confidentiality and medical privacy. You have absolutely no right to know anything about my medical history.
I do, because it does affect me. It affects people you come into contact with. Yes, it does.
It does not.
It does.
Based on what?
Beverley has the right to refuse to say.
She has a right to refuse to say.
Yeah.
Well, the fact that she's refusing to say means to me that she hasn't had it.
I just can't believe what this country's turned into. It's so sad.
That proves my point.
But Nina, what it proves to me is you don't understand anything about the science of this spike protein.
And you do, and your scientific degree
vaccination
entitles you to? You have a scientific degree, you have a medical degree, you're an epidemiologist, you're a virologist. Any of these things? Any degrees that you're... Show me a bit of paper that you are qualified?
Nina, you've had the vaccine. Surely that's enough, isn't it? Because that protects you. I've had the vaccine. Storm's had it. That protects us against unvaccinated people who may be spreading it. Yes?
Do you understand about asymptomatic transmission? So what do you think?
Of course,
do you think you now have a force field around you? Like, how do you think this vaccine works? Explain to me the science.
Well, hang on, we haven't got time for...
Hang on a minute. Hang on a minute. You know, you don't have to berate me and sort of say, you don't understand. Listen, a vaccine, 2 doses of the vaccine protects me to a certain extent, to a percentage.
It protects you. You've summed it up.
They've also discovered that the transmission is lessened.
Why? Because it ameliorates your symptoms.
No, it's not just that. The transmission is reduced
because you have a reduced
transmission.
Not just because you're coughing less. All right, Storm.
We're going to speak to Liz now from London, who says we shouldn't get back to normal at the expense of others' lives.
So you'd say wait a bit longer, Liz, yeah?
What I say is that we live in continual limbo and chaos in this particular government, so it's very hard to know what to believe. But if you look at somewhere like Germany, which has a bigger population, has had less vaccinations, and yet it's only got 3% and falling, whereas England, 23% and rising, despite this, magic bullet.
23%. What is 23%? You haven't explained.
23% of transmissions of infection, and it's rising despite all the vaccine efforts. Now, I'm not slagging off the vaccines. Well, if you go onto the Reuters site, it goes by country. And at the moment, Germany only has a 2% infection rate that's going down.
Not testing like
it does antibody tests all day long. It's very careful. People like to slag Angela off because she doesn't want people to come in without being very cautious and careful. But that's why Germany is succeeding. And we have one thing, the vaccinations. And like we screwed up on Grenfell and so many other things, I just think we live in so much chaos. We don't do things properly in Britain.
Hang on, we've done really well on the vaccination, Liz, haven't we? We've gone gangbusters on it.
Yes, but it's like a quick fix, and we still don't know what the long-term effects are. We know that it's a success. We don't know. We may not know for years, but all I'm saying is I'm not slagging off the vaccine. I think it's a great thing. But I don't think people should rely upon it as the only thing. We are not going to get back to normal. It's not going to happen. We have to live with COVID, but that doesn't mean we have to live with X amount of deaths. I don't think that's right.
OK, Liz, thank you very much. Thank you. I'm puzzled there. Storm.
We're going to speak to Emily now from Wiltshire, who says we accept flu deaths, so why not COVID deaths?
And roughly 10,000, Emily, I guess, is the ballpark, isn't it?
Yeah, I think for me, it's thinking about the fear of death in general. We're all going to die one day of something. And I think what COVID's done is and these lockdowns have restricted the people that are actually living to a life that sometimes isn't even worth living anymore. People have lost their jobs, their economies, I think of the school children that are taken away from their friends for weeks on end. And I just think, we're so scared of dying. At what risk to other people that are living is kind of my point.
And if we have 10,000, Nina, that won't bring the world to a halt, will it?
It won't bring the whole world to a halt, but why should we give up? Why should we give up in the struggle to sort this and to come to grips with it? Australia, they've had fewer than 1,000 deaths. And just to say how virulent this disease is, and thank God we need vaccines, and thank God we have some kind of means for fighting against this. They've had an outbreak in Australia which has come from the quarantine hotels. And because they have so few cases, they can really track them and find out how they've been passed on.
I mean,
excuse me, can I just finish my story, Beverley? they've tracked them, and they've found that people have caught it by just passing by each other in a shopping centre.
Yeah, well, I'm not surprised. That's how viruses travel.
Well,
yes.
exactly, but
and it is quite infectious.
So in you know.
Sorry, Beverley.
We would all love to see zero COVID deaths. Believe me, I would like to start talking about something other than this on a daily basis. There is a drug called ivermectin, which is readily available. It is cheap. It is not patented. It has been proven in various countries around the world. There is an amazing intensive care doctor in America who has used it and has been talking about it. And the YouTube guidelines are you cannot talk about ivermectin because at the moment we have the vaccines.
It's not been trialled, on COVID.
It has, of course, it's been trialled. It has been trialled. It has been trialled. And
European Medicines Agency
worked,
says not to use it outside medical trials.
Why do you think that is? Because it's not going to make anybody any money. And even Merck, who make ivermectin, came out and said, we do not know. And Dr. Teslari in this country...
And that's a cure for COVID, is it?
It has had the most phenomenal success rate. Dr. Pierre Corey in America, intensive care doctor, he has been using it. In America, some of the doctors are free to use it because they're not hamstrung by the same ridiculous regulations.
Isn't this just...
And he's just said, look, we could cure this across the world in a month.
Then why?
We
come on.
I promise you, look into it. Look into it.
The FDA,
Nina.
In the USA, the FDA say taking large doses of this drug is dangerous and can cause serious harm because it's not licensed for COVID. We kind of have to go with that, don't we?
It is a drug which has been readily available since the 90s, for 40 years. It has cured river blindness. It's an antiparasitic. The side effects are almost zero. The guy that invented it won the Nobel Prize for Science.
But none of that helps.
There is censorship. There is censorship on the use of this drug.
You're sounding like Donald Trump. You know, let's inject ourselves with bleach.
Just look into it. Do me a favour and look into it.
Come on, you know... Do you seriously think that if there was a cure for COVID that simple, that the World Health Organization or whoever...
Why is the YouTube guidelines say you cannot mention ivermectin? We will take down your videos.
So this is medicine by YouTube, for heaven's sake. You know, this is loony time. I mean, come on, this is swivel-eyed loony time.
Well, maybe someone will trial it properly and we'll find out that it works.
Oxford University have started a trial now, but they're only doing it on the over 65s. It's a trial designed to fail.
All right.
Oh, so over 65s aren't, worth saving then?
No, they're introducing it 3 weeks after you've developed symptoms. It needs to be used really early on.
OK, right.
I honestly don't know why you don't have the Nobel Prize for Medicine yourself, and because you're talking as if you have the authority of somebody
you don't have
me.
When you have to attack me,
you do not have the authority.
One would suggest
I'm just going to say we don't know that drug works. That's the important thing. Later, our stories of the day, including over 75s being chased for the BBC licence fee and extreme measures in Pakistan to increase vaccine uptake. After the break, though, how old is too old for a woman to have a baby? Most men say 36, but that's men. Are they right? 0207 862 2222. See you shortly.
In the original novel by Mary Shelley,